Hello, patients and friends. It's Dr. Rick Erickson, Winston-Salem, North Carolina. I want to talk to you all about balance and falling, because over the past couple of weeks here in North Carolina, we've had snow, ice, about a foot of snow, and we've seen dozens of patients who have slipped and fallen. So we want to minimize our fall risk. And two things we're never getting away from: the ticking clock, or the aging process, and gravity. Gravity's trying to push us down constantly, and you myself too, we're aging, and once you're 50 or about 50, 60, 70, 1/3 of the age of that age group is going to fall in a year. So as we age, risk of falling is increased, and 1 out of 3 are going to fall. And I did it myself in the snowstorm and the ice storm. Outside walking, it was slightly dark, so it was hazy, overcast, and uneven surfaces, ice, snow, or some people that walk and hit a curb or a crack in the sidewalk, and you can easily slip and fall. And we don't want to do that. So lots of things you can work on to minimize falling. Balance starts with the brain, the spinal cord, and has a lot to do with the eyes. So we exercise the eyes, move the eyes and the head often, and the feet. So the brain, the spinal cord, the eyes, and the feet. So spinal alignment, of course, is critical. So when we're in better alignment, balance and coordination is much better. But little things that you can use at home: a broomstick, walking stick, or even just a counter to stabilize yourself so you don't tip over, because you're going to work on walking and stepping, lifting one leg, work on balance. Force yourself to balance, like even dancing, moving back and forth with your feet, your ankles will help coordination and balance. But you can use a stick to stabilize, those of you that need it, because don't tip over, don't fall. And other good things to use at home: one is a rocker board, or a Bosu ball, or a stretch ball to sit on and work on stabilizing and improving balance. But this kind of thing, our Bosu ball, forces us to use our feet and our ankles and stimulate balance from the feet up the spinal cord to the brain. So do all we can to improve that. Now we're going to go to another room. So also, when we're younger, let's say we're 10 or 20, we bounce. And as we get older, we don't bounce like we used to. So when we fall, that's not good. We're going to fall and break something. And, oh, I made a mess. But minimize fall risk. Peripheral neuropathy. These exercises help peripheral neuropathy, pain, numbness, tingling in the feet and the legs. So do these things, and I can give you patients more information on this. 30 to 60 seconds every day, or at least 3 times a week. Thank you very much.